For years, people have used body mass index to figure out if someone is obese or if their weight is healthy relative to their height. By the late 1990s, the World Health Organization adopted BMI as a primary screening tool to forecast health risks. However, a new study by the University of Florida finds that BMI is deeply flawed and that there are much better ways to help predict future health concerns. To learn more about the study's findings, we are joined now by Dr. Mainous, a professor and vice chair for research in the Department of Community Health and Family Medicine at UF. Thank you for joining us, Dr. Mainous.
Thanks. I appreciate the opportunity.
So let's start with this. What exactly does BMI tell us, and why, or what does your research say about why that system might be flawed?
So what BMI tells you is it basically takes height and weight, and it creates a sort of a computation to sort of indicate what your sort of generally your body fat proportion is. All right, that's what it's doing. It's an indirect way of doing that. And we have other ways too, whether it's waist to height ratio, whether it's waist to hip ratio, but it's a pretty easy, quick way to do that. What we use it for is to predict risk for like cardiovascular disease, like diabetes, even cancer. So it's a very widely used thing around the world, in fact. So that's what it's used for. It is very easy to get, just height and weight, and then we use a computation from there. So it's very inexpensive and it's easy to get.
So why do you think this is not the system we should be using? Why is it, why do you feel it's deeply flawed based on your research?
Well, it's been around for a long time, and one of the things about it is we started doing studies probably 10 or 12 years ago looking at this, and what we found was that particularly for people who are considered to be normal or at a healthy BMI, we were finding that people had other sort of problems like elevated glucose,
Mm.
hypertension, things like that. And so we tried to find other ways to do it because we said, well, if how are we going to find out who those people are? We looked at things that range from grip strength to other things to try to figure out all these people who we were saying were healthy weren't really healthy because BMI really was having some problems. And so we looked at other ways to do it, and that sort of led us to where we're going now, which is rather than looking only at another measure, indirect measure of body fat percentage, why don't we just use a direct measure of body fat percentage, since that's really what we're trying to get to.
And that, I assume, is what you would call bioelectrical impedance analysis. Did I say that right?
You did. Well, bioelectrical impedance analysis is a way to look for your and compute your percent body fat. And what it does is it runs an electrical impulse through your body. And so certain parts of your body are going to conduct electricity better than others. So body fat itself is not a very good conductor, but water, muscle are better. So we would use something like that, and it's also accounts for your age and sex as well. But we would use that. We haven't historically used that because, well, a couple of reasons. One is the way that we do it is that some of the studies from back in the late 1990s suggested it wasn't very good. Although there's a lot of new studies that show that it actually is pretty accurate. But when it gets down to it, it's pretty easy to just get height and weight. The problem with just getting height and weight and using BMI is that it misclassifies people.
But in essence, bottom line is though you're trying to measure fat, correct? Is that the essentially where you're trying to, classify somebody as, unhealthy or healthy or needing to lose some weight?
Absolutely. The point, whether we use BMI or waist to height or any of those sort of indirect measures, is we're still just trying to get a measure of that person's body fat percentage, because that will then give us an indication of downstream risk for disease. And so what we decided to do was, why don't we look rather than at another indirect measure? Why don't we use a direct measure? That's really what we're trying to do anyway.
You talked about BMI's inability to maybe find problems with somebody. Could
Mhm.
it actually have the opposite effect in, let's say, somebody who's a bodybuilder, right? They may have a tremendous amount of muscle, correct? And so they're going to weigh a lot more than somebody who's not
No,
has that much muscle mass.
you're absolutely correct. It misclassifies people who we would say have normal weight obesity, that we say that they're healthy, but they have a high percentage of body fat at a BMI level that we would consider as normal. But it also would misclassify people who have low body fat, but are actually fall into, say, overweight. And so it's because it is a general measure, an indirect measure of body fat percentage. Both of those groups are misclassified. The people who we would call overweight obesity, or colloquially skinny fat, or a bodybuilder, would both fall as being misclassified by BMI.
I know you also mentioned the DEXA scan as another possible option. So tell us about that. But in mentioning that, is DEXA and the bioelectrical impedance, are those going to be viable options for people as far as cost, getting them into doctors' offices?
Well, I think that DEXA, most of the researchers would consider that to be the gold standard. And so it's an imaging, it's an X-ray based imaging strategy, and we use it now for things like osteoporosis and things like that. It is not typically used in practice for this for two primary reasons. One is the cost. So if you can just measure height and weight, that's pretty easy to get. Costs in generally somewhere between $300 and up. Now, you can say, well, we might be able to get one and get insurance to pay for it, but since insurance doesn't pay for that because this is not an indication that they would pay for, the patient would have to pay. So the cost is prohibitive of having DEXA scans. The other thing is, it is a technology that's not easily integrated into normal clinical practice. BIA, on the other hand, can be integrated into clinical practice. In fact, we have a machine here at UF that we use in one of the clinics. But it cost prohibitive? It is expensive to buy the machine. But when you think about it, it is really on par of the same cost that you might have to spend if you were going to buy a scale to weigh a newborn. So it would just be another piece of equipment in the in the clinic. So I think it's viable in that way. It would not be something that you would charge back to an insurance company. It would just be something that you would do now in the in the clinic.
Doctor, what do you hope other scientists, medical experts will get from your research on BMI?
Well, what I really hope is that we move away from just continually writing criticisms of how BMI misclassifies people, and move to a strategy that looks like it is an improvement. I think that when we want to talk about changing practice, what we hope is that rather than just saying, "Hey, BMI is no good. It's you got all these people with normal weight obesity and they have these problems. Oh, and we've got these people who are bodybuilders and they're not getting picked up, but this is the best we have." My contention is that's not the best we have. That we now have something better, and if we use that, integrate that into practice, it will actually improve our predictions for for disease prevention. Remember, one of the things that we do when we take things like BMI and classify people as overweight or obese is we're really trying to prevent other diseases, downstream diseases like diabetes or stroke or
Sure,
heart
deadly
attack.
diseases.
Absolutely. And so if we misclassify people, we don't pick out the right people, then just having an easy, inexpensive strategy that doesn't work, that just doesn't seem to make a lot of sense to me.
Dr. Arch Mainous, we so appreciate your time. Thank you.
Well, thanks a lot. I appreciate it.
Thanks for watching. We've got more great content for you, from news to the arts to the environment. So be sure to like and subscribe to WGCU's YouTube channel and follow us on our social media platforms for the stories that matter to you.